What are sperm retrieval techniques? These are procedures in which sperm is harvested directly from the testes or the epididymis, which is the tube that carries the sperm from the testes to the vas deferens. Sperm retrieval techniques have greatly improved the success rates in IVF where there is a male factor infertility. These procedures are performed in cases where there is an absence of sperm or a very low sperm count on semen analysis, such as a previous vasectomy, a failed vasectomy reversal, a complete lack of sperm on semen analysis, a lack of sperm on semen analysis due to an obstruction in the male reproductive tract, and when there is a congenital bilateral absence of the vas deferens, which is a duct that connects the epididymis to the urethra. Sperm is extracted from the epididymis in cases where there is obstructive azoospermia. That means there is an absence of sperm on semen analysis due to an obstruction in the male reproductive tract, which can be caused by a previous vasectomy or an infection, or when there is an absence of the vas deferens. There are two procedures that allow such an extraction. The first is percutaneous epididymal sperm aspiration, or PESA. In this, a needle is inserted through the scrotum into the epididymis and sperm are removed. This is performed as an outpatient procedure under local anesthesia, but can be performed in the operating room. The second is microscopic epididymal sperm aspiration, or MESA. This is a minimally invasive surgical procedure in which sperm are removed using an operating microscope. It's usually performed under general anesthesia and it allows for a large number of mature sperms to be harvested. Two procedures that are commonly performed to remove sperm from the testes are first, testicular sperm extraction, or TESE. This is indicated in patients who have had a previous vasectomy, when there is an absence of sperm on semen analysis, or when previous IVF cycles have failed due to poor sperm quality. It is sort of a biopsy in which a small amount of testicular tissue is removed, and this is then used for IVF cycles. It can either be performed as an outpatient procedure using local anesthesia or in the operating room using mild sedation. The second is microsurgical testicular sperm extraction, or micro-TESE. This is indicated in cases where there is no sperm on semen analysis due to issues with sperm production. In this, an operating microscope is used to find pockets of sperm production within the testes, and then sperm are removed from the healthiest of tubules. It is a longer procedure that's performed in the operating room under general anesthesia, but it can rarely be performed in office using light sedation. Depending on the IVF program, the harvested sperm is either used fresh by timing the sperm extraction with the partner's egg retrieval, or it can be frozen for later use.